Yeah, so hi friends, my name is Sagar Dogra and you have, I believe, watched my previous video that I shared on YouTube. And I did receive a few likes, you can say, and a few views, but unfortunately, like I said before, the awareness on pudendal neuralgia is quite limited, and the practitioners mostly who deal with this exclusive symptomatic disease are often found in usually developed countries like US, UK, France, and Italy. However, despite this, not everyone can afford such an expensive process of diagnosis and treatment. It's often left out to, try remedies, since most cases, most individuals would lack any, you can say, any sign or symptom which is reflective in diagnosis on paper rather. So, I've been going through this issue for the past 7 months, and I truly believe and truly understand what most of you might be facing and how you are really coping through this issue. My salute to you guys, and my sympathies are with you, and I really wish I would be there with you in person to, uh, live up your spirits. But it's quite difficult when my own spirit is quite low, on morale is quite low. However, there are some few updates which I would like to share with you. The first update is that there has been not substantial but very minimal improvement, and these were all due to the allopathic medicines which were prescribed to me, and some few over the counter, um, you can say, supplements which via reading and via research are found to be helpful with uh, what I'm assuming I'm facing, because I've not yet been diagnosed. However, I'm assuming that I'm facing. For those who have visiting my channel for the first time, so my name is Sagar Dogra and I am from Jammu and Kashmir, India, and I've been suffering from this issue for the past 7 to 8 months now. When I mean this issue, I mean an unconfirmed diagnosis of either pudendal neuralgia or category 3 non-bacterial prostatitis. It started off during while masturbating, and during the phase wherein I used to drink a lot of coffee, eat spicy foods, and coming to my particulars, my age is 27-year-old, and I weigh 115 kgs. And most of my lifestyle is usually lethargic in nature. It's not I'm not a mobile person. I usually in office, you have to sit in one portion. Maximum of the time is spent in office, so you very well can understand. Now, the pain variates. In the beginning, it was less, but in between, it had become so unbearable that I used to cry, that I used to pray to God to please take me up with as soon as possible. But God had some other plans, and He's trying to test me through this, and I really cannot challenge Him, but I really will live up to His spirits. So I'll just give you an update on what things have been prescribed, and this is not an expert advice. This is just please consider it as I'm just sharing my experience with you guys. So the first thing I was prescribed was I was also given pregabalin, but I didn't find it useful, so I'm now on gabapentin, 300 mg, alfuzosin 10 mg, cystopan 100 mg, Bavarian, which is an SOS painkiller, which I don't take. Once in a while I did take, but I'm not abusing it. I just used it once or twice, not more. Paracetamol once or twice, not more. Over-the-counter supplements is vitamin B complex, vitamin D, ALA, omega-3 fatty acids, and your digestive supplements. I think it's just yeah, it's a gut supplement which I taken. Also, I tried valerian root, which I read online, which really helps in the issue. And this is something which I've been exploring for the moment. I've been trying yoga. I do yoga in the morning, 6 o'clock every day. It has somewhat helped, and also I use cocox or donut whenever I sit. So one thing also I like to add on is that the more less you sit, the more better you feel, and the more you stand, the more better you feel. So sitting is a big aggravator, so I would suggest you guys to avoid sitting as much as possible for the moment. You can increase it later on, but for the moment I would suggest that you guys stop much sitting, or you use a cushion which is in good quality. Don't just use those normal ones, because they usually have no effect. It will just be you wasting your money. And trust me, this entire process of yours is not cheap, so don't just waste more of your money. Sorry for the burp. Also, you have to make some changes, which I understand can positively help you guys out. One is you guys should start using um, uh, comfort chappal, sandals, or shoes, because that you have to relieve as much less pressure as possible. Which is These are all, see, it's a holistic approach. Don't think that you're only one taking allopathic medicines or homeopathic medicines will be helping you. It is a holistic approach, and you have to have the willpower, the finance, and the mental prowess to fight this. If you think that, oh yes, doctors have prescribed me something and you'll be cured, that's not going to help. I am literally have lost my job. Tell me, I know what I go through. Try using comfort shoes or footwear, and choose memory foam or memory foam especially, and memory foam gel based mattresses when you're sleeping, because that's the best. Don't go and purchase orthopedic. Choose the one which I just told you, that is memory foam, because this will be really helping you to relieve pain even more. It will just give you relief which you might have never found. So choose memory foam more than anything else that you find in the market. And I just had my latest appointment today with the doctor, and she has given a few prescriptions again. This is with the pain specialist now that I'm having my appointment with, and just looking forward to she has prescribed me gabapentin only. She's told me to continue with that. She has told me to take painkillers. They will only prescribe painkillers. In this case, there's no treatment, just painkillers, because the nerve cannot be treated. There's a surgical approach, and there's an approach of reducing its feelingness, which is only possible through your either surgery or allopathic medicines. That's not cure, it's only relief. Remember this thing. Cure will happen naturally or will not happen at all. Okay. And now about 3 months it's chronic, less than 3 months is not chronic, right? Now the fun fact is actually, yeah, I've been you know I've been having several since this duration. I've had several consultations, but none of the doctors were able to explain to me what's the difference and how to identify the difference between pudendal neuralgia and category 3 non-bacterial prostatitis, because the fun fact is that all of the symptoms portrayed by these diseases are almost similar in nature. Very few differences are there, very few in numbers. I can also tell you 2-3 numbers difference are there, but the thing is that the only factor which in pudendal neuralgia can categorically help in his diagnosis is the nerve blocks. The nerve blocks is the first diagnostic tool which according to many have proven it to be the only holistic diagnostic tools, and other like your pudendal neuralgia. Uh, it's like they put some. Uh, it's like a TENS, TENS machine is there. So that they help diagnose. They send sensor signals through the nerves and they test, the sensitivity. But that's the failed approach. It has its efficacy has been proven to be failed in 99% cases. So there's no use. You're just going to waste your money and it will further aggravate the pain. So nerve blocks is fine. It's not that bad. I've heard about it and I'm planning to get it done. Maybe in future. First I'll try the allopathic way, then go through this method. As of now I'm not, but I will sure look forward to it. Further, if we go, my email ID is dogra.sagar.in@gmail.com. I'm repeating once again. dogra.sagar.in@gmail.com. So any of you who would like to connect with me via email or any other media mode can surely connect and we can discuss. If you want to share anything, we can share, because being mentally and physically strong both are very important in this case. And I know how physically weakened a person is, and twice as much mentally a person can be weakened in this situation. So my sympathies are with you all, guys. So you have my email ID. You can reach me out anytime. And yeah, looking forward to getting myself cured. Cheers.